Hi, Mr. Jones. I know you're excited and you're packing up, getting ready to go home today from the hospital. I just wanted to talk to you before you leave because while you were here, you were diagnosed with high cholesterol or hyperlipidemia. This can have many causes such as smoking, excessive alcohol consumption, diets that are high in saturated fats and trans fats, and low levels of physical activity. Also, things like stress, genetics, and obesity can play a role. We discovered that you had this when we did some blood work that was to check your lipid levels or your fat levels in your blood when you were fasting, if you remember that morning, and your ALT and creatinine kinase. So when we checked those things, we found out that your cholesterol was higher than is healthy. We need to help get your cholesterol in balance because when you have high cholesterol, you are at increased risk for stroke and cardiovascular events like a heart attack. By treating this condition with medication and lifestyle changes, we can help you lessen your chances of having these devastating health issues. I know you're probably curious as to how you got this, and you mentioned that your brother and your dad also have it. This puts you at higher risk for the condition. Also, because you smoke and are overweight, you are at higher risk of having it. We can help you to quit smoking. There are lots of things we can do, and many of these things are even at no cost to you. So when you're ready, you just let me know, and I will help you get ready to get set up for success. You had mentioned that you haven't been able to exercise as much as you would like, and eat as well as you would like since your job changed, and it makes it difficult for you to make these healthy lifestyle choices. What I'd like to do is set you up with a dietitian that can help you make really good changes with your lifestyle and help you to eat foods that will help keep your cholesterol in balance. You've also been prescribed Atorvastatin, and this helps to keep your cholesterol numbers in the right balance. This medication is a statin. It is used along with diet and exercise to treat high cholesterol. It will lower your bad cholesterol, the LDL, or I like to call it the low down loser cholesterol, and triglycerides, and this will increase your good cholesterol, or the HDL, the happy cholesterol. Atorvastatin has some side effects that you need to be aware of. One of these is rhabdomyolysis. This is very serious. It is a breakdown of the muscle tissue that releases protein into your blood that can damage your kidneys. You would experience dark reddish urine and less urine than usual, muscle aches, severe muscle aches, and weakness. You should alert your primary care physician if this happens because they will want to treat you as soon as possible. You said that you don't drink alcohol, and that's good because drinking alcohol while taking this medicine can cause liver damage. Some people may have an upset stomach with this, so you can take this medication with food, and that seems to help. Statins work best if you take them at night, so maybe you could take this with your evening meal or maybe with a snack before you go to bed. You should see major changes in your cholesterol levels within 2 to 6 weeks after starting this medication. You will need to see your primary care doctor in 8 weeks to check your blood work. You cannot eat before this appointment, so you may want to make it early in the day. After this, your physician will monitor you at least once a year and make sure that you ask them how often you need to come back to monitor this condition. I know that's a lot of information to throw at you. So to recap, you are starting a cholesterol-lowering medication. Do you remember the name? Yes, Atorvastatin. This is a statin drug. What will this do in your body? Yes, it's going to lower your bad cholesterol, the low-down loser, and it will raise the good cholesterol, the happy, the HDL. And then when are you going to take it? Yes, at night with food. You will need to have 2 appointments to follow up. One will be with a dietitian that we will have contact you. And who else will you need to follow up with? Yes, you're going to see your family doctor in 8 weeks to get blood work done to see if the medication is working. Do you have any questions for me? Oh, yeah, I can get you that information on stopping smoking. In fact, I brought it with me just in case. I'm so proud of you for taking control of your health.